Hi, everybody. Thank you for being here with me today on Radiant Health with Suzanne. I'm so excited yet again. Every Thursday, I'm all excited every time I've got a new speaker. We are having a repeat speaker today. We're having Dr. Scott Miller. Hopefully, he'll be on any minute. But he is we call him Dr. Scott, but he is actually a physician's assistant right now. And but he is a former pediatrician and he has dental expertise because he's dental training. And so that's why we've asked him on today to talk about this incredible technology from a wearable technology patch from Lifewave and how we can benefit from using these patches on tooth symptoms. And on that note, we are only talking about symptom relief here. We are not well, Scott's a doctor, but I'm not. But we aren't talking as a doctor from how to treat or cure any particular disease or disorder. We're basically talking about, primarily talking about symptom relief and like pain and, pre-surgery, post-surgery on more rapid healing. So I'm going to get Scott on here just a minute. I saw him enter. Welcome, Scott. And just, to give you a little bit of backstory, well, not really backstory, because I'm not going to talk a lot about Scott on the introduction. I would like for you, if you want to know more, to go back to go on my YouTube channel, Suzanne Roth-Paul dash Lifewave. And there you are, Scott. I think you're here. I hope. Let me
I
see.
am.
You are, but you need to be made a co-host. Hold on, honey. Sorry about that. Where are you now? Now I don't even see you.
I'm moving
Oh, there
around
you are. There you are.
cryptically. Yeah.
Okay, yeah, sorry. Larry was helping me. So anyway, I'm just doing a little introduction that I had you on a couple of, pre-holiday in December. And if anybody wants to learn a little bit more about Scott, you can see that introduction when he tells his LifeWave story journey of how he got to be with LifeWave and to be with us. And you can watch that. And there's lots of recordings. And I highly recommend if you want to watch more product reviews on any of the products that we're going to be talking about today, any of the patches that you go there. I have over 30 videos with a 4-week pain series and patching up for pain series. And then I also have a product review on each of the patches that we represent, Lifeway represents, which is 11. So you can get to see those individually. We are talking about a wearable technology that is called photobiomodulation. And I just want to show you what the patch looks like. It's a little disc about this size with an adhesive back, and you can wear it on your skin or on your clothing. And it's non-transdermal, so it's safe and effective. And that's what I'm all about, is non-toxic products that you wear and use and put on your body, and then obviously anything that you ingest. I have one here on my hand just to show. This is our amazing LEVY patch, and I have a sun damage on my hand, and Scott's got one
I,
there on his
I have
cheek.
one. I have one right here because of our toxic mold exposure, you know.
Yes,
And
yes,
so
and it's helping
I
draw out. Yeah.
it's the crazy. Sorry, I didn't mean to interrupt. So go ahead.
Well, you're on now. So welcome and let's get started because I obviously we're going to be talking about dental health, but I'm sure that we're also going to be talking about a lot of other things. And Scott's talking particularly about his mold issue that he has, and it's showing up on detoxing out of the skin on, his
Again,
face.
yeah. So you saw, said dental. So my dad was a dentist, my mom was a dental hygienist, and I went to dental school before having a head-on motorcycle versus bus that led me into mainstream medicine initially. So I was taught a lot about dental health. Wait, did I freeze?
No, you're still with us, but
Okay, cool.
yeah, but if you're going to talk a little bit about the mold, if you want to share what you're doing with
Oh,
your
so
skin, and then I want to pause because I just want to introduce your book again. It's behind you. I forgot to do that.
it's I was told it was good, by the way.
It is
I
really
do
good.
have
That's what I
it.
wanted to do. I wanted to say that I'm halfway through it. Okay, we'll go back to this for a sec. That I'm halfway through it, and it is just all I can say is this: wow, wow, wow. I'm looking at this, going, oh my God, the things that you have been through, and the fact that you're here today helping so many people when you had to go through your own trials and tribulations. And it's a fabulous read. And I really want all of us to support Scott on this book that he did because it's fabulous. It's disclosing a lot of information during the pandemic that we experienced. All of us, the good, the bad, and the ugly. And I just think it's a fun read because he's got such an eloquent way of speaking and sharing. But it's also, emotionally, it's just emotional, Scott. It's so emotional. So thank you for
Well,
sharing with
I
us on.
would say outside of that, it's, I look at it where I remember somebody came when I had lost my license, where, where it's like, okay, my ability to prescribe pharmaceutical medications to people. And during that time, I had already started moving away from that as much as I possibly could while still, still being able to, serve my population, serve kids, etc. And what's fun, it's not funny, well, kind of funny, but I remember, so I was at a fundraiser and I had heard about Lifewave, and I was again looking at all these different modalities that I could use to help people. And I remember, and I told you this last time we talked, but I see, this man and woman, Kristen and Glenn, wearing Lifewave shirts. I'm like, I know that thing, the shirt. It's like I'm aware of that thing, except I didn't know what it meant, what it was. I didn't, and when I say this, I'm going to say this unapologetically. I didn't know it was the greatest technology that I had never allowed myself to fully dive into at the time. And I am so, when like God puts or God allows challenges to be placed in front of us, and then it's up to us to see, like, how do we use those challenges to grow and experience. And some people might say, well, that's hard, and it's like, I don't like that word. It's like it's a new challenge. And if, for me personally, for me physically, to like, had I not gone through all of those things and then had that random happenstance meeting with Kristen and Glenn and not been introduced to Lifewave, I would have had multiple surgeries. I would have had a total right knee. I would have had surgery, like a surgical repair on my left knee. And I'm not going to say that the patches cured it, because we can't say that. But uh, uh, nothing else did. Yet I am, 3 years later, I'm healthier than I was by far. And you need to rein me in, because it's something that's just, it's such an exciting thing. But so yeah, so we have black mold. So we had 4 neurotoxic molds in our home. We had an indoor swimming pool. We had a leak in a boot, in our roof. And so, like, in our bedroom, like when we were doing a little remodel, and I pulled back the baseboard and it was eaten away. It was shocking. And every time I would go into the bathroom, I would get congested. Like, my nose would start to run. I'm like, that's weird. And it's like, I knew something was wrong. I just, I was busy. I'm lazy. I don't know, right? Like, I wasn't curious enough to check it out. And all of a sudden, when we did that, and I was like, wow, because we thought I had cancer. I went and got a colonoscopy. My son was having neurologic, like memory issues. Shelly was having, my wife was having issues with memory. My daughter was having mood dysregulation. So there was this, and you add mold to 5G and all these other things. I mean, there's just so many different, components to it. And Suzanne, it's like, when I think about serendipitous events, um, how, like, the even the way that I found out about Lifewave, and having an event at this is called the Black Pearl, and I had a wife who was telling a story about her vaccine injured husband. I don't know if I can say that. And these people
Yeah.
came up, and you should try these for her, the glutathione and
Yeah.
carnosine. Anyways, it's, I mean, because of because of the technology, without a license, I've been able to fundamentally change because of the technology has helped me fundamentally change the lives of hundreds and hundreds of people.
That's amazing.
Like,
I mean,
like
that
I
that's
mean,
it. That's it right there. And Scott, I'm very spiritual. I'm very God. I'm a Christian, and we say there are no coincidences, and that things happen for a reason. So I'm just sorry that you had to have a terrible accident to see and to go through a lot of that.
you know, the experiences or the life situations that God puts in our path, they're not accidental.
Right.
They're
And
for a reason. It's how
yeah,
we choose to move
yeah.
through those.
Right. And the mold issue too, and we were not going to talk about that today because that's a whole nother subject, but people don't know that mold is an issue. And it just is, it's starting to come, be more and more known. In the last 10 years, I've known about it, but in the last couple of years, we're starting to really address that it is a root cause for so many autoimmune issues. And so that'll segue me into dental, because that's what everybody's here today for, is our situation with our mouth. And what I do want to mention, Scott, is, our dental health is really the gateway to our good health. And I only learned this, recently, that if you have bad teeth, there's a pretty good chance that you have bad health. And I can attest to that because that's how I am. And so, with dental amalgams, with mouthful of fillings, mercury fillings, and then having to have them taken out, and then crowns, and then obviously an implant now. So we're going to touch on all of that. But I want to ask you, Scott, why is it that our mouth is our gateway? And is it because it's so close to our brain? I mean, is it, because our teeth and our brain are so, intricately connected? Is it because of that? But we just know that it's really harmful to have a lot of teeth issues and to,
Well, sorry, keep going.
well, no, I'm just saying, like, if you have good teeth and you don't have all of the silver fillings, and you don't have crowns, you don't have implants, and you don't have gum disease and things like that, good for you, because that's chances are you're in pretty good health. But those of us who aren't as fortunate, we know why it is. Root causes, they're definitely there, and bad diets and genetic factors. But what is it that makes the mouth so important for keeping that hygiene impeccable and keeping us well?
It's interesting. So I again, I went to dental school first, and in in from cardiology to neurology to neurophysiology to microbiology, like I just, even saying that, I think back, it's like, wow. I mean, it was histology. It was intensive, but we didn't actually talk about it. It wasn't drilled in. It wasn't highlighted, the impact on oral health or oral pathogens and cardiovascular health, neurological health, respiratory health, right? And it's, so people have, so, getting into, I can't tell this story, but I did, I, I did, we did a project on a seven eighths amalgam, right? So it's like 7/8 of the tooth is an amalgam, is mercury, right? Um, and it was a whole thing about using gold instead of that, and Tupac and his baby's mother. But that's different. That doesn't matter. But it was like, how do we make it weirdly funny? But I was thinking about it, it's like 7/8, the 7/8 buildup, right, of this, and every time you're biting down, like it just it being in your mouth, but it's getting absorbed into the tissue. It's getting absorbed, and so when you think about your oral mucosa,
Mhm.
um, it's like, put some drops of something in your mouth and just let it dissolve in, right?
Yeah.
How available, that oral mucosa is. So when you're using toothpaste, and again, I don't want to get, rain of hell on me for saying this, but looking at, for somebody that preached fluoride for so long, and then
Mhm.
over the last 5 years, I'm like, it's kind of like, having a pediatric clinic and talking about vaccines, where it's like, I can't believe I was so brainwashed to think
We
that's
all
not a
were.
problem.
And we still are.
It's
They're
a
still they're
huge
still promoting it.
problem.
People don't
Yeah,
know.
it's a huge
Mhm.
problem. And so then when you're talking about amalgams and mercury, Um, you're supposed to be wearing gloves when you're touching it, right? Like
Yeah.
we're we were not allowed to touch it without wearing protective equipment to
Mm-hmm.
be able to use it. So it's like, so we're told that, and then we're putting it in the mouth.
Yeah.
That's
Yeah.
a problem.
Yeah.
And so even when it's being removed, you have to be thoughtful about it. That's where, like we've talked about that,
Right.
going to a
Right.
biologic dentist. So
Right.
when they came into our home with the mold and they remitted it, basically what they did was they blasted it throughout our house.
Right. Because it's
And
everywhere.
that's what happens if you have somebody that's just removing an amalgam and they go in with high speed and they're like and
Yeah.
drilling it out. You're
Everywhere.
aerosolizing,
Yeah.
and you're creating this huge problem. And since no one's testing for heavy metal toxicity, so
Mm-hmm.
you look at, especially because dudes, whatever, but especially women, when you look
Right.
at autoimmune issues and thyroid issues, they're not looking at heavy metals and the impact of
Yeah.
oral maxillofacial issues. And anyway, sorry.
Well, and I was fortunate to have a functional medicine doctor who did look at heavy metals, and the first thing she did was do all of my metal testing. And when I came back with the results, I was age 47. I'm now 61, and at age
You're
47,
61.
I'm 61. Yes, yes. And I couldn't be doing better. I mean, that's well, I can be doing better and I will be doing better, but it's like I could never go back to the 40s because I was such a wreck. And we know why. But the one thing she asked me was, how much tuna fish do you eat? And I said, what do you mean tuna fish? I don't eat much tuna fish. She said, well, your mercury levels are off the charts. So that was like the first red flag that was the root cause, no pun intended, with my roots in my teeth, but that was the root cause of so much of my emotional, neurological, physical, all the things that had been happening to me. That was an environmental cause, and because those things came, they weren't in my mouth before, and I had cavities from eating too much sugar and also had a compromised immune system as a young girl. So we know that is what we're dealing with here, Scott, with so many people with our age. I had to have an implant. One of my teeth broke. Why did it break? I don't know. What happened? What was going on there with that particular tooth? But, the dental implants, then you're getting the root canals because the roots now are getting damaged. That I'd like you to talk a little bit about the harm of root canals, because this is a big deal right now. Quite a few people are asking me about them and reached out because they want to know, what can we do to patch and what can we do to mitigate the harm? And it's like, oh boy, you got a root in there that's impacted with, maybe it's an infection. You want to talk, where do you want to start with?
Well, and every time you bite down. So if you think about that, every time you bite down, you're chewing whatever, you're squishing, if you will, you're squishing that because it's kind of encapsulated into
Yeah.
that space. Every time you bite down, you're actually pushing that into the tissue, so it's going systemically. So now you have that bacteria. Now that's the problem where we talk
Okay.
about
Okay.
stroke and cardiovascular issues, right? Like that
Okay.
that's getting shoved in, like getting. I'm trying to keep it kind of simplistic,
Yeah.
but it's a huge problem systemically. So we think about it, it's like it's a toothache. It's like, yeah, but like it's not just a toothache. And I want to say something on that really quick. Where like this would be to parents with younger kids, but like just generally speaking, I can't tell you how many times I've looked into thousands of children's mouths, and parents are like embarrassed where they're at. We
Yeah.
take good care of their teeth. Like my daughter at 5 years old had a cavity. I'm like, it's like, that's impossible. Not a word. Like, how is that possible? Like Scott
Yeah.
Miller's child cannot. It's like, with all of my background, how can she have a cavity? She was a mouth breather.
Mm-hmm. Yeah. So was
And
I.
so when you breathe through your mouth, so they call it xerostomia in elderly, and there's medications that can cause it. But for so many people, if you're sleeping like this, I'm not talking about snoring, just like
Yeah.
mouth open a little bit, that dries out the oral mucosa, and we
Right.
need like the enzymes in our saliva protect our teeth, and they protect from the bacteria that eat away at it. And so you can have kids, adolescents, adults where they're doing everything right, but if you breathe through your mouth and it's drying
Yeah.
that out, you
Yeah.
are going to predispose yourself, because it's like, how did I get these cavities?
That's
That's
one
a
of it too. So your diet is important, what you're
uh,
consuming,
yeah.
environmental, and then obviously breathing with your mouth open. I just want to interject. I'm using a product called Nose Breathe. If you've been with me on a lot of my talks, I've mentioned it several times, and did something you can get off of Amazon. It's $40. My biological dentist recommended it, and it's a little guard that you put in your mouth that it's not attractive. It has a thing that sticks out in the front of it. None of those guards look attractive. My husband and I both wear it. Talk about unsexy, but it helps keep your mouth shut, and that's hard for me. But at nighttime it works, and so I highly recommend Nose Breathe. And for those of you who do sleep with your mouth open, there's a whole nother conversation around that in my sleep when I talk about silent nights on the patches. So you can go watch that video, and I go into depth on that. So Scott, yeah, we have a lot of areas where
Sorry. Yes, I apologize. I didn't mean to deviate there.
oh, no,
Sorry.
no,
I
no. I'm just
apologize.
saying we have a lot of areas that we can talk about that is causal of these issues. But let's get down to the nitty gritty here for a few people on, I've already called you about my 100-year-old father who they want to do a root canal. And he's 100 years old. He's got chronic heart failure, and he has AFib. He's fragile. And we're like, how can we doesn't need a root canal. He doesn't, I mean, he's in pain. Okay. That was the whole thing. He has an infection in the root. So let's talk quickly here about if you have someone that is fragile like my dad, and or even someone like myself. If I were to get somebody tell me to do a root canal and drill through my crown and go through the tooth, do down into there to drill that out, I've heard nightmares about the cavity that's left. I'm not, that's the wrong word. The hole that's left down there gets filled up if it's not treated properly. So can you talk about all of these dentists right now talking about the gunk that's left in there that's causing all these autoimmune issues? Because is it bacteria that gets in there? Does it get infected even more? It's silent. It's a silent killer and causing all these issues and autoimmune issues and chronic conditions. Not that easy to.
Seriously. So I'm gonna get. I'm trying to figure out how to not get in trouble. Where, I'm thinking about when we were doing when we were like doing root canals, and it's like you're drilling it out and you're putting like jamming gutta percha down into the
Well, is it the
into the
product? I mean, we can just avoid any sort of conflict by just saying what they're doing, and that can be the cause of the problem. So not do you think that everybody who's had a root canal is affected by it, or is it
no
a
no
percentage? So some
no
people
I
think the root canals are fine. Okay.
I mean, it's just, I mean, it's like with anything, there's so much that has to do with our our like metabolic processes, our detox pathways, things like
Right.
that, right? It's like, how is one kid an asthmatic, and if he gets near peanuts, he goes into anaphylactic shock, and somebody else,
Yeah.
right? Where there's certain, what I would say are genetic predispositions, and then environmental factors that kind of, it's like you've got the gun, and then the bullet that's loaded into the gun that causes that.
Yeah.
Um, to I
Well, Scott, while you're thinking about
not
that, I just want to ask though, if you've got a dentist and you go into a non-biological dentist or one who's not looking at the root causes and the environmental impacts, um, how would they know what your condition is and what kind of autoimmune issue you have, or just how you're doing if they don't ask? So let's just say somebody's going to go in and they're being recommended for a root canal or a crown or an implant. What is the first thing you would tell them to do if they don't have a biological dentist? I mean, I'm lucky I have one here I can walk to, but not everybody has them in their areas. What would
I
you suggest they do? Do you need to do some testing, check
I
out
would I would I
metal?
would do I would do testing. I mean,
Before you do anything, lab
before,
testing needs to be
I
done
mean if
on their health.
I mean,
Okay.
if it was something where it was acute, where you got some like acute infection where where your face is swollen up, like you've got
You're
to
in
do
pain.
something, right? And
Yeah.
and you can't manage it, and um like knowing what your homocysteine levels are, knowing what your
Okay.
MTHFR status is, knowing what your glutathione levels are. It's like, because we need to know how effective our detox pathways are. Checking, there's oh, come on, like B12, because we
Right.
need our B vitamins to down regulate homocysteine, et cetera, et cetera. So and then so it's not like you can go get these immediately, but then like heavy metal tests, um they it's a hard, like, what it's a hard question to answer because I've it's funny because there's medicine, but then I lived in the dental field for so long also, where I'm like, wow, was everything I was taught in dentistry wrong? And it's like, no, shit. Sorry, like I saw,
Yes,
like,
and no.
may-
Yeah. Yeah.
maybe, like,
Yeah.
what? And
But I think
obvious.
you're good at preventative. I mean, there is a certain amount of preventative that is knowledgeable, but when it gets
Oh,
into
and
all of the
like my best friends are dentists. Like my core brotherhood, all of them are dentists, and
okay.
we've had these conversations, and so and they're amazing at their craft. They are,
Right.
and like so it's there's a part of me where it's like if somebody's like, yeah, I'm doing endodontics now, I'm like tell me what like tell tell me what that means. Like
Yeah.
what are other options, right? It's like, and I sent you a video by Dr. Thomas Levy, who's a cardiologist,
Oh yeah,
who
let's
goes,
just you want to let's mention him. Let's see. I guess in my show notes of the video when we're finished with this, I could put that link in for people. Dr. Thomas Levy, and he's talking about the harm of root canals. Is that I haven't even had a chance to look at it. Is it
oh
root canals?
come on, really?
Yeah, no, I am sitting around,
I
I'm sitting around polishing my teeth all the time. I don't have time to look at that. Well, this is the other thing is we also have dental work that's for aesthetics. And so think about people that want to have all their teeth crowned or like capped and all of that for aesthetics. So that's a whole nother conversation. But won't you agree?
I'm less concerned about that. Like I'm less concerned about, because when you're doing, as long as you're not doing the amalgams, I'm less concerned about that than when I, because of, even in pediatric medicine in lower income families, what do? It's always amalgams. They don't do, you know, they don't, they'll put this, I mean, oh my gosh, I can't tell you how many, so you see this child with silver crowns on, right?
Yeah,
They
yeah.
don't seal. So they're not sealed. So they go and drill around and then they throw these on and they're not sealed. So now they're far more likely to get reinfected, and then you have this stainless steel in their mouth.
Right.
And I've had, and it took me a while to figure it out, where in fact it was a specific situation about 7 years ago, where a mom told me that her daughter was having just almost debilitating fatigue and
Yeah.
like etc. And I was like, well, what what happened? And she's like, well, the only thing I can think of is she went to the oral surgeon and had to have a bunch of dental work, and she had a bunch, like a lot of her teeth were capped, put the stainless steel crowns on, and within a week it was like this, it was a
It was like instant.
negative transformational
Yeah. Yeah.
dive
Middle. Yeah.
in her mood and behavior and overall
Well, our
functioning.
bodies aren't meant to be have metal in them. And there's so many surgeries now with all kinds of implants and repairs of your knees and your hips and all that. And my dentist explained it to me that way, that this metal it's kind of like it's an electrical current that's damaging and it can mess your neurological system up, which I already have challenges with. But why don't we talk about how we patch for this? Because that's what people want to know now. So I know how to patch on the face, and I've helped people with pre-surgeries. And we do YH, glutathione, carnosine, and Eon for inflammation, for reducing swelling, for pain relief, and then obviously healing. Are there things, I mean, I have something I wanted to show here. They're related to our organs. A lot of our teeth are related to our organs. I mean, obviously, you know this. And I have a chart that Julian Chung gave me, and I can put this link on my bio, on the recording. But every tooth is related to an organ. And the biological dentist explained to me that you can go look at that organ and see if it's unhealthy. If you've got kidney issues, you've got liver dysfunction, you've got, gut issues, they can trace that back to your tooth that could be giving you problems. What's your feeling on that? I mean,
I,
is that how we would patch for? We'd go to look at the organs to patch for a particular organ with the number of tooth that's we've got a problem with.
so yes, but then also with pain. So and this is what's hard because and this is where I tell people I know that and I don't know that there are many people that I can respect more than David Schmidt for what he's done, but or even Dr. Just there's people, right? But I save patches because we've used them on our animals, right?
Yeah,
I mean,
yeah, yeah.
we stick them all over. So like I save them because if so for a tooth, there's because you're going to be doing, and so you would be doing ice wave at like what is it, Li4, and then like on your like medial ankle, like on the inside of your ankle, and then like three levels down. So it'd be,
I
and
didn't
I'm
see
not,
anything you just did, but you're talking about different points on.
yeah, different
Yeah,
points. So
yeah.
LIFR, ST44, and ST36, I think, because I use SP6 at that area. But that's one area. That's one way for acute dental pain.
So that's
But
on the hand and the ankle. Is that what you're saying?
hand, leg, like just like below the knee, kind of on the shin, and then ankle. So it'd be like Li4. Seriously,
You know what? And Larry's on. If Larry's really good with all the
oh, he's way smarter than I am. So,
well, he could tell us where those I have a chart I'd have to go look at, but you're basically saying that those are specific spots on the body for pain no matter what tooth, or are we looking at specific organs
generally speaking, and then Aeon, right at the GV, like 24 and a half,
in the
24.5.
third eye or right
Yeah,
in
third eye.
okay.
And
Okay.
then there are times where I would have somebody stack either glutathione or currency. But I am always agree. So a buddy of mine who's a dentist, had somebody come in with strabismus, like I mean, just like the masseter, the muscle, like that main muscle of your jaw was just locked, and he had the patches, and he called me. He's like, "Hey, dude, I've got this gal in,"
Jaw. Is
and
that kind
so
of like lockjaw? Literally?
well, I mean, just where it's not like lockjaw where you would look at like
Can you open
tetanus,
this up?
botulinum, tetani, but just where it's just clenched and painful.
Okay.
And he used energy enhancer and ice wave, and he said within, I mean, seconds, but it was like he was like less than 20 seconds. She was able to
I was
open
putting
her
on
mouth.
this on the spot, on
So
the
he went,
place
he went, he went right here, like
on both of
right. I mean, like when you clench down and you can feel that
them. Okay.
prominence there, that main kind of the that we'll call it kind of the bulb of the master. And then I had him do it right behind. So I did ice wave and then energy enhancer. And I told him, I was like, just guessing, but let's just try it. He called me. He's like, she just looked at me stunned. Like, I mean, it was instant.
What is this? Yeah, no,
Yeah.
that's great.
And
And
I
you
and
had
I told him, I said, listen, I'm Jesus. And then he said, you're going to hell. And I'm like, I know. And then I had to repent. But no, I'm sorry. But
I
it's
know it's
like,
actually quite amazing when you do get somebody to get the relief. It's such a joy,
but
you
that's a
you
month.
feel like
Like when you have somebody like that, you're looking at, for a dentist, you're looking at 3 to 4 weeks of that kind of discomfort. Right. So to
okay.
be able to put patches on, like for dentists, it's like, oh my gosh. I mean, I think about like podiatrists and like all these different surgeons, obviously, but for dentists, it's crazy. The
Well,
kind
and
of relief.
medications obviously are what they throw in. And my dad's had to do I think it was 2,000 milligrams of pain antibiotics because he had an infection in his root, in the root of his this crown, or
Yeah, they
excuse
hit
me,
him with
the calf.
amoxicillin. Yeah, so they hit him with amoxicillin, two
It was
grams.
something different. It wasn't amoxicillin, but he was, and I don't know, I
No,
haven't talked to him yet, but if it stopped the pain enough to where he doesn't need to do the surgery
no,
anymore,
no, because okay, I shouldn't say that, but
it'll make it
because
worse.
the way the infection where it is, it would be like having an abscess. You still need to open. You need to do something,
Mhm.
right? So if you've got a deep abscess in your skin, you can give antibiotics, but if you don't open it up and drain
Yeah,
that pus out,
yeah,
it's you're not going to be able to kill it, and that's the
yeah.
problem with the root canal, where or somebody needing a root canal where you've got an apical infection or an infection at the base of the tooth, at the root of the tooth.
Hmm.
Um, you're, I mean, we talked about this where you asked me, it's like, what would you do if it was, like if it was my mom, or where I would take the tooth, especially because it was a molar. I would take the tooth out versus doing a root canal, because if they do it improperly, if they don't, I mean, you've got four different areas that you have to go in and
Remove.
and
Yeah.
correctly, do the procedure. So if it's not a periodont, or seriously, it's been 30 years. Sorry, come
Trying to,
on,
yeah, the
what's is it?
Gravendorn.
It's an endodontist, right?
Yeah, endodontist. That's who he's talking
Yeah,
to. Yeah.
yeah. So if
But,
it, and even so, you have to be really diligent about how you do it. I mean, really diligent in your
right.
craft to be able
That's a
to.
whole nother that I don't know what's happening. That was the last I heard that they were going to still do some, they're not taking the tooth out. So I have to deal with that. But let's just say we have a young girl that Kathy has mentioned to me, who one of our Lifewave team members, and she says that a young woman has had 3 years ago, she had a root canal and she's in such pain now that it's depressing her and she's, really having a hard time and she is seeing biological dentists, but nobody's able to help her and she doesn't have the patches. So in a case like that, we know that she's full of toxins. I mean, this is obviously bombarding her system. What would she do if is there any answer that can happen for these folks that can't afford or aren't wanting to take this stuff out? There really isn't. I mean, you can patch it literally with pain relief and maybe some relief, but long term it's damaging. So what would you say to someone like that? She needs to get
So, I mean, that's a really hard question in the context. I mean, because if you said if it was knee pain or it was elbow, I would, knowing the why, like why is that still going on? If they went in and they were treated, then
wouldn't happen.
should be an alleviation of symptomatology of pain. Like a situation like that where, I mean, like always start with X39 in that
Right.
type of thing, like always.
And just wearing it daily
Yeah,
or two
yeah,
socks?
yeah. I
Well,
mean, I wear it. I don't.
every
There
day.
isn't a day that I don't. I wear. Do I need to? No, but I'm doing better now at 51 than I was at 41.
Yeah, same with me. Well, here's
Right?
something I was going to ask you though, Scott, because I do know a lot of dentists because I've been researching this for a while. They do say that these folks get the tooth, they get it cleaned out. They get, they have to do whatever they have to do. They have to get the crown off. They have to get everything off and they clean out that cavity it's actually a hole, I think, of where the root was. And they clean it all out and people's symptoms go away right away. But what do they do with it afterwards? Because this is the problem. What are they filling it back? Are they leaving it? You can't leave it whole
You
there.
fill it. And
So what
again,
are you filling it with? What
so
is,
we use something called gutta percha, where we would fill the canals where you have this material, so it's filling it up. So you allow for, to get for the back. Basically, you have the infection. You're able to get the infection out, and then you close it back up, and then put a crown on it. Now, I'm
so that's a safer material than
I
what
I
was.
didn't I didn't prep enough because we I've had some calls.
Well, no, and you don't have to answer
so
that. It's
so
just
I don't,
that.
like, if I went into like kind of the matrix of gutta percha, what they're using today, I don't know. But I
They evidently have a safer product that they're
yeah,
using. I
I
don't know what it is. I didn't do the research either, but
yeah,
that's what we're trying to do is empower people that have these issues that they need to go get those out, opened and out. That's been my what I've heard. And there's lots of things on YouTubes and things you can go do your research. But
I've done enough without looking at the specifics of what the industry is using for doing root canals. I and then seeing the again, this is because I know that like my friends are like very, very good dentists, but I think about medicine and I think about, I could pick 50 doctors I know, and it's like I wouldn't send an enemy to them
right,
because
right.
right,
And you want to stay
like,
away from dentists as much as you can if you that's why that's
and
why
I'm
you
saying
need
not with dentists, like these guys, I mean, like these guys I would trust with my family.
the dentist that you know.
The dentists I know, unless they said something like what we're talking about, would be like,
Right.
huh, let's have that conversation because we were indoctrinated.
Right.
We were
And that's what
literally
they're still practicing. So perhaps this young girl, that's what happened to her. And then Larry had brought up too about gum issues, gum disorders, gum disease, gums, and doctors will say that your gum will not grow back and you
oh
can't.
no, that's so that with periodontal issues, and so you
Yeah.
can you can rejuvenate gum,
Well,
like the tissue.
want the patches? What would you do for gum support?
I'm not saying they would do so. X39 and X49 when
For
we're
the
looking
symptoms of, for
at, so
symptoms.
when you look at the tissue, so it's very vascular.
Yeah.
And so what typically happens, and it depends on, we don't see this typically in kids, but as you get older and you have decreased blood flow to that tissue, and so and then trauma, even how you brush your teeth
Hmm.
matters.
Hmm.
But but
And floss, how you
and
floss. I was over flossing.
yeah, you can create trauma, which can cause breakdown of the tissue. But when you look at the science on, let's just say, we won't even say the patch, we'll just say GHK copper, X39 GHK copper, or
Yeah. Yeah.
X49, right? Like AHK copper. When you look at what it does for the growth of and the endothelial lining, it's shocking. It's so crazy. We're talking about something that literally, it's like every day you get older, your blood vessels get like a day and a half younger. And
Yeah.
this is like the literal NIH. This isn't Lifewave saying it. This is the NIH talking about reversing the NIH, not me,
Copper
not the
peptide.
company. The
Hmm.
NIH talking about reversing fibrotic lung disease. That's crazy sauce, right? Upregulating P53 gene. So the cancer, the cancer shutoff gene, right? Upregulating P53 gene, where they say the NIH says it can stop
Right.
stop
The
tumor growth, right?
preventative.
So and then you start looking at what it does for tissue growth and vasculature. It's nuts.
Okay, so
It's
you can, if we were the X39 and we coupled it with X40,
theoretically
well, theoretically, that's why you want to do it. We
based
are
on the
talking about
NI.
patches today, but yes, and the X49 for cardiovascular, because you're saying that dental issues are related to, the heart disorders and heart disease, that whole connection. I can't speak
Well,
it.
that and directly to arterial blood flow, right? Like
Yes, circulatory.
directly related to what we would call angiogenesis. And so being able to heal the vessels that are
Okay.
bringing oxygen, like blood and nutrients and oxygen to
Yeah.
your vital tissues and organs, it leads directly to an increase in that angiogenesis.
Well, and Larry also, he was so good in asking a bunch of questions, and he's here with us tonight to make sure I ask them all. He was
Well,
talking.
and he needs to correct me too, because I don't know anything.
Well, no, he's no correction here. You do. You just said you just explained to us in technical terms and kind of medical terms, what is happening with the copper peptide, the genius of having, having enough copper peptide in your body, and the patches are activating, that they're not causing it, but they're helping support this copper peptide to do its
Well, they're
work.
kind of directly activating it. I mean,
Yeah, by photobiomodulation and by wearing them, and the same as when the sun hits your skin and helps you to
yeah,
make
it's like if somebody's like vitamin D, like the sun can't, cure something. It's like, no, but
yeah,
yet that light that is going into us activates like subcellular melatonin, or it's
and we know
like
the
the
value
sun
of
cured us, but we know that specific wavelengths of light can
yes.
heal innumerable diseases.
Right. And that's what our products do. And so we're saying this is symptom supportive when you're wearing them. So if you've got anybody who's listening that they've got, severe gum issues, they've got an implant, they've got a root canal, they've got these things that, at this point, a lot of us just want to know how we can mitigate the damage and from causing further harm. Because I have to have one ripped out of I am supposed to have this dental implant ripped out of my head. And I'm like, I don't even want to go there. I don't want to think about it. And so I'm doing all the preventative, but ultimately I don't know that I will or not. That's the point. But when you have a root canal and you're having all these symptoms and you're having these like autoimmune issues and unexplained symptoms like the mold, we could say doctors are not looking at your
No.
mouth health and your teeth health. And so we're here to, enlighten people that it's very important to know that if you have these things and you're having all these mystery symptoms, could be the cause. And so what the dentists are doing today, like Dr. Scott is talking about, is they are noticing that I guess the way that what it was being done for root canals, because you didn't explain to me exactly when they're doing let's just say an old version of a root canal. My dad's going to get a root canal if he's going to, and he's not seeing a biological dentist. They're going in there and they're going to kill the root and pull it out. Is that what they do? And they want to get rid of the
Well, you
infection.
you drill it out, right? Because there's that infection. So you're going in. So it's the nerves. So the problem is it's the nerve. So that pain is because the infection is hitting
Yeah.
that nerve. So you go down through the root. So you have the blood vessel, the vasculature of the tooth, and then the nerve. So you go down and you're basically eliminating that.
And they're also saying that that's so harmful because our bodies are not meant, those roots are there for a reason. And so I don't know if you have an infection, what you can do with that. I mean, I know that you wouldn't want to remove it, but you've got to treat it. You got to do something because people are in pain. But it's what they're filling it with, what they're going back with, that's the issue. Because that dentist, these non-biological dentists, let's just say one that was done 10 or 20 years ago, they were using a product is that what it's doing, is leaking and causing all of the issues that potentially are giving the autoimmune issues?
Potentially. And I'll say this because it's, to blame it on just teeth. I was just on the phone earlier, non-hospitalized person, but
Hmm.
bunch of autoimmune issues. And the first, not the first question asked, and I had the privilege of taking care of her kids when I had a license, and it was so thyroid, autoimmune. I'm like, do you have a chlorine filter for your shower, right? Because especially for women, when you're inhaling, because it's getting absorbed into your skin and you're inhaling it, and that directly binds the you have thyroid binding hormone, the thyroid binding receptor site, and chlorine binds to that, so it can affect how you're so you can have disruption in thyroid regulation. So it's, and which will then oftentimes lead to a number of, because usually it's not just like one autoimmune issue.
Hmm.
Um, and so I look at it as an additive thing. So it's like if you lived in a biodome of perfection and you had a root canal, are you going to be in trouble? Probably not. But because of the cumulative effect of our environment and the things that are sprayed on our food and the things that are sprayed in our air, and all of
Right.
these things, it's just it can be there are certain things that can be just the straw that breaks the camel's back. Because our bodies are listen, I mean, we should not be able to drink a 12-ounce can of Mountain Dew and survive. The fact that our body's like, I will accept that and figure out what to do, like that's
I know.
crazy.
I
Right?
say the same thing. It's
I
like I
just,
don't physically know how people are walking and talking with some of the stuff that they
yeah.
eat, and
So
not to
the
mention.
Yeah,
Not
so the fact
just,
that we can put like poison like that, or in our body, and our body is like, it's like
yeah,
all hands on deck. It's like, oh, he just did it to us again. Let's go figure it out. So our body is shockingly resilient, but there are certain things that based on um like different, again, genetic predispositions, et cetera, or our toxic load, like where is our rain barrel in terms of
yeah.
what we're dealing with. So if somebody's like, I'm going to get a root canal, I wouldn't go tackle them and say under no circumstances. I wouldn't do that. I'd be like, oh, well, what's going on? Right. Like
Right.
I would, like if they asked me to, I wouldn't tackle them anyway, because I don't have a lot of upper body strength. So I would probably just hit them and then fall and then be like, why are you laying on the ground? I'm like, because I haven't gone to the
Need to
gym.
talk to you. Well, that's, I guess, a takeaway here because we are getting close to our end.
Oh,
Unfortunately,
sorry.
time goes so fast with you, Scott, is that people, want to be able to use the patches no matter what their decision is. And, even for pre-surgery, like I said, we've
Oh,
done a fair amount of preparing for that.
I'll say this, tons of, so I can't tell you how many people I've had where, especially like X39 and carnosine, or X39 carnosine glutathione pre-surgery, and then day of add Aeon. And I had a dude that had like when I had a dude, he was like 71 years old, a number of health issues, and he had to have oral surgery. And when he went back a week later, the oral surgeon was like, I don't understand. He's like, this is what we would see, 3 weeks out.
Yeah.
He
Yeah.
was he was like, I think it was like five. It wasn't a week. It was 5 days. He went back. And he's like, that's what we would expect to see like 3+ weeks out. And he was stunned at the difference. And my buddy was like, yeah, I don't have any pain. I mean, the swelling. I mean, it
Right.
was like
That's what I've seen
that's the
too.
beauty of it when you look
Mhm.
at you when you like with carnosine as a dipeptide, and you look at what it and cardiovascular health,
Yeah.
carnosine,
And
and
brain health and
brain
brain
health,
health.
like shocking when you look at what it's able to do to actually bind to certain uh inflammatory agents in the brain, and we'll just
Okay.
say detox. But the combination of X39 carnosine and glutathione pre, and then adding Aeon, oh my goodness, like super gold. Like I mean, we use all of them at times where it's like, because we have them, but like when we're doing targeted things, like that's what I recommend pre.
For
Um,
pre, post, and then you've got post, which is again,
and then if there's any pain at all, I
yeah,
always add Ice Wave. But
right.
a lot of times they're just doing so well with the X39 carnosine and glutathione, and then adding the Aeon for swelling, like just decreasing inflammation and swelling. They don't even need Ice Wave, which is cool. I mean, like
I
that's cool.
I noticed that with one of my dental patients who had a bunch of gum work and had some teeth, a bunch of stuff done, and we didn't even talk about ice wave or energy. She just used the Y age. Do you don't use energy at all?
Oh
Or,
yeah, I do. Oh my gosh,
oh, well, you talked about it for the clenching,
I,
but
I'm
I know you use energy, but would you use it in if somebody's got pain with Ice Wave, combine it? I mean, I think everybody who's listening here and you're new to Lifewave, it's like, what are they talking about with all these different patches? But you got to bring out the big guns when you've got like some chronic inflammation and systemic issues with some of these teeth
or
issues that we're talking
or
about.
or if it's acute, right? Where I
Okay,
mean,
yeah.
there are times where um I mean, I can think of off the top of my head about 15 people, like I'm literally cycling through, where I mean I was pretty unapologetic about doing. I mean, I used Ice Wave and Energy Enhancer because if you think about like what we're trying to do, and without it sounding like woo woo, I mean we want cells to be able to communicate with each other, and when cells can't communicate with each other
Yeah.
effectively, alarms go off, and then we
Yeah.
have pro-inflammatory cytokines that are released to go figure out why. And so that's a problem. And what energy and like the beauty of the combination of using Ice Wave and energy enhancers, like the positive negative, where the charges, where you're
Yes.
getting cells, and then you're taking energy from the, we'll call it fat cells, taking energy from them, and like you're like, it's like nitrous, you're amping that up,
Utilizing. Yeah.
you're
Yeah. Yeah. Yeah.
utilizing it. So your body's like, ah, I've got this. I can do this, right? It's like you're in neutral, and all of a sudden you're in fifth gear, and you're able to like locomote. It's giving the from a cellular standpoint, it's giving it the energy to be able to function properly. And when that happens, the body goes, "Thank you," and
So
that's where we literally see a decrease. I mean, it's cool. It's so cool.
are you saying too that if you're a little plumper and you've got more fat on you
I
that
didn't say
I,
that,
I no,
but
but I
yes,
am
yeah,
because I'm not bragging, but I don't have a lot of body fat on me, and that's not a good thing because when you get toxins in your body, guess where it stores, which is
the
in my fat
nervous.
head. Well, in my
Yeah,
fat
it's
head,
yeah.
because
Instead of it going to the
and yeah,
yeah, so mycotoxins go to your adipose tissue, and if you're thin, it goes to your nervous tissue.
exactly. And I am one of those, that's why I'm like a little on the wired side, and you guys see me, I can get all hyped up and talk really
Well,
fast.
listen, I will
Yeah.
say this: I have a plan that I can give you that can make you chubby. Um, you don't, I don't recommend
Hey,
it,
I'm a
but
baker. I can do that all on my own. I know exactly how to do it. Bring back all those terrible toxins that, got me in the mess I am. All
you
right.
take
Well, I
all
do,
of those mycotoxins out of your nervous tissue and put them right into that adipose tissue.
yeah.
I'm a
Yeah.
giver.
I think that, we did cover most. Larry did ask something about the reason why root canals are so dangerous is because the nucleus, he was talking about the nucleus it caused nucleus brain damage. I don't know exactly what he was talking about, but we do know that it impacts the brain. Do you know what, I mean, Larry, I don't, if you wanted to speak out, but you asked me about,
Yeah, actually, I'd like to hear him talk. So I know that the
Larry, you can unmute yourself
yeah,
and if you're still here, I think he should be. And you can just ask that because we know that that's the problem is that all of these toxins are in our mouth and it's so close to the brain. That's why I was saying that, it gets absorbed so much quicker, right? And I don't know if Larry's on to be, let's see, is he still with us? You know what? He might have had to hop off because there's a training at 7. Excuse me, a training at 6 or coming up here. So he might have had to hop off. Yeah, I don't see him on here anymore. But yeah, we were just talking about, from the perspective of if you've got somebody that's having a surgery, something coming up, and they've got whether no matter what it is, how you can patch for their symptoms and that you can help them beforehand to reduce the inflammation and get them prepared for when they go in and have their surgery. And that's what I did for another client. I had her do YH beforehand. She put them on all the jaw on her face. I didn't know any other ways to do this with the organs at the time. She put them on the key areas on her face, went in for the surgery, obviously didn't have them on during the surgery, but she was wearing the X's. She probably wore X39. We probably put Eon on her for inflammation. And then afterwards we patched her again and she didn't have any issues whatsoever. And she came back pain free. She was excited. So I think
well,
that's
I would say if you have them, I mean, like, I fortunately don't need to get dental work, but if I had them, I mean, I don't know that I would wear Alavita except out of my need for vanity. Um,
yeah, yeah, yeah. Oh, you're saying whatever patch you have, use it.
yeah, but you don't. I mean, I would say that what you said, YH trio.
Yeah,
So,
yeah.
I mean, if you have X3949, that's like I consider that a no-brainer to
Yes.
use. Period. Especially if you're going in for a procedure, because you want to set up your system to be able to detox, because it's not just
Mhm.
activating, it's not just its ability to potentially activate cells in your body that help,
Right.
can't say it anymore, but do that. It's also activating the different, when you look at the 19 different ways that GHK, like overtly, shockingly awesome ways that GHK copper impacts in a positive way, obviously, the body. It's
Right.
great. It's crazy. And it's like, it would be like you trying to pick up a car and then you have 18 other people come over and it's like, oh, now we've got it, right? It's like,
Right.
oh, look at that. It went from
It's
impossible to very
an army
easy.
of support.
It's
Yeah.
an army of support. And so when you look at GHK and so X39, X49, when you're adding that
Hmm.
support to your body and you're looking at having, I don't care what procedure you're having done,
Right.
um, it's, start it before and continue, for 3, 4 weeks after, it's like yay you in terms of the support you're giving your body for healing and regeneration.
That's a good point. I didn't mention how long you would do this, but obviously, it took a while for that injury or that situation in your mouth to happen. So you do want to give it, maybe even you're going to be wearing the X's every day. Most of us do. The other one, Scott, is Eon, of course, because dental work is very stressful and emotionally charging. So what that's a given too. If you don't have
I
any,
love that.
go
So
straight.
so down regulating, so getting the body into parasympathetic tone, and not just that, but the combination with Aeon and glutathione, because depending on if you're getting nitrous or if you're put under, like for real, right? If you're getting general anesthesia or nitrous, you want to be able to detox that.
Oh yeah,
So
and of course any of the meds that they're giving you. I'm laughing because your cheek patch is flapping around
oh,
in the wind. It's an advertising for you there. No,
no,
but
I'm not. I didn't mean it's. I've been taking it on and off because I'm like, oh, don't you know? But
okay. Well, I think I hope we haven't, I mean, we still have a lot of people on. We've got 14 participants still here. I don't know if you have any other closing comments. I would like to wrap it up. You've had a very long day, dear, and I don't want to keep you anymore. And people can reply at how this, if this helped and helped you and helped, the information we're giving. And if you need to dive deeper, we can figure out maybe another time. We've got a whole year ahead of us. We can always kindly ask Scott to come back after he's had a very calming day and he didn't have to be, going 100 miles an hour. But that's the most important thing is giving people the options, knowing that this product is helping so much in the healing and in the
well,
inflammation.
let me ask you a question. How many have you given away?
Patches?
Yeah.
Oh, I've lost count. Hundreds.
Okay. So my point, like when I think about that, like when you have something that works so well that you're gonna it's like not losing money, but where you're willing to give it away. Like I can't tell you how many times I've gone to the post office and mailed patches. I'm like, just put them on, just put them.
Yeah.
I like there isn't a pill unless it was like a super high potency narcotic where
Yeah.
you're like gonna uptun somebody, right? There's like to have something where it's like I like that I've seen work in so many hundreds and hundreds and hundreds and hundreds of people where I'm like I'm getting in the car right now and driving to the post office
Yeah.
and sending
Yeah.
it to you,
Yeah.
and it's like just get them on. I've never seen anything like it, and so I've heard people say that, well, it didn't work for. They can't not work. There are times where if somebody is wired differently, like even with ice wave where it's like left right or
Right.
I have a friend of mine who is wired differently, and it took me quite a while to figure out because of her migraines and headaches. It took me quite a while to figure out because everything I did made it worse.
Yes. Oh,
Like,
can do that.
and
Yeah.
yeah, and I was like, initially I thought because she was a girl, but that's not.
It usually is. It
No,
usually,
but
well, and
but when I switched it, when I started, so I'm so sorry, Suzanne's like, how do I
well,
edit this
no, and
video?
I'm trying to keep up with you. I'm not interrupting. I'm trying to keep up that when you're saying you're switching, that we're talking about, we typically wear the two patches, the energy and the ice wave. They come with two patches, a tan and a white. And because of the way our body, works and the way these patches were designed, you've got a tan that you wear on the left typically and a white you wear on the right. So on
Yep,
the jaw pain, for instance, that's typically how you would wear that if you have pain and you need to,
or headache,
or
or
headaches
even
brilliantly. And Scott helped me with head pain. And this is our jaw and our head is head pain. And what was working for me was we switched them. It's called polarity. Some of us are polar opposites, that's where that expression comes from. So you end up switching them to the opposite side if they're not working. So put the tan on the right and put the white on the left. And then what worked for me brilliantly was adding the Eon on top of the tan, no matter which
backing it.
side. And I don't know why that is with the tan, if it's supposed to be more, I don't even want to say the wrong word, but we normally stack things on the tan patch. And you can also put the white on top of it, but the tan is the one that is the most, you have that closest to the skin. And then you put the Eon. And then in rare occasions, you can add the X39. But the X39 can cause more pain. And that's where we have to be
It,
careful. But
it Yeah.
It's getting in there and trying to do the work. It's like when you have a scab or an injury and you know how it starts itching and it starts like hurting you because it's healing. It's kind of the same concept. And so some people put the X39 on. It took me years to figure this out, that that's causing more pain. And then people are like, of course this doesn't work. They just needed the Eon on with them, or they needed the energy or the ice wave patches instead of the X39 for pain. Lots of people do great with X39 for pain. So it just
Yeah.
depends
And
on
that's where,
who,
and
yeah.
well, sorry, what I tell people, it's like, be curious, like be experimental. I mean,
Yes.
it's after
And have
church
us
last week, like
have your little
I
patch.
mean,
Yeah. You're going
yeah,
kind of
it's like
going
you
in and
look at
out.
the packet and it's like they say to put it here, here, here. It's like you don't need to do that. Like I like even X39, if I had an injury, I would put it directly over that area of injury, right? Like
Yeah.
I'm not
Yes.
going to put it on C7. I'm going to put it where that injury is. And
Okay.
if just because I've done it for so many people, it's like if I haven't gotten results, or if we get results and then it comes back, it's like move it around. Like it
Right.
works. It just I've never
It can
seen it
even
not
just
work.
be within an inch. You know, that's what I
Yeah,
would do with my
literally.
head pain, jaw pain, anything on your mouth where you're having those discomforts. And then I even had something. What the heck did I do that for? I was having some discomfort and I put something, I took the patch and put it inside my mouth and just
Oh,
held.
you were having that migraine. So remember when I told you,
Oh, you were the one. Yes, put it on where you said pull the front of your mouth. Ah, and I
well,
you
press. There's a specific like people hear
press
that.
and
Why
pull.
is he saying there's a very specific part
It
in?
helped. It helped. It stopped it, but then my hand started hurting from having to press. So I was putting the patch in there instead, and it of course was getting messy and wouldn't hold. But be creative. And when you've got somebody that needs help, your job is to obviously help them because they are in pain and uncomfortable. So I would say that, Scott, that was the other thing I just wanted to mention again. I'm gonna put this that Julian was so kind to give me. I'll put this on the link, or I'll put this link in the show notes, so to speak, and look at the organs, because you don't have to be a patch expert on meridians or organs. You can just go Google what would be the location for acupuncture point for my liver. And you can just ask liver acupuncture point and it'll pull up and tell you where to put it. That's how
Yep.
I've learned, kind of like being creative about if I've got an issue with an organ, where would a needle go in?
Well,
And
especially if it's lung, if we're talking lung, where you have like by the like lung one
yeah, that's
bilateral.
unusual. That's a different one. And I know we use lung one a lot for other symptoms, which I don't quite comprehend yet. I'm not seasoned enough with it, but I know that that's this up here for, it's also for pain, stress, all kinds of things. And this is
Well,
probably,
that's because when you're looking at how energy flows from
yep.
midline up, I mean, that's a huge, because you got energy that flows up and energy that flows down. But
Okay.
putting lung one, especially with energy enhancer on lung one, it's pretty cool. Like we've done that for people that are in the ICU that are either on a ventilator or
Wow.
ventilator, and obviously we have to do other stuff, but it's
Yeah.
super cool. It's real. I mean,
And
I
that's a good one for also anxiety, stress. I had gluten poisoning, and Nikki, I was about to go on to one of my lives, and I told her I was like a raging lunatic, and she told me to go get energy and put there on lung one point. So that really, within seconds, I was calmed down and I realized I didn't even think about how I was feeling after that. So really powerful, powerful stuff. Okay, Scott, I want to let you go.
I was gonna say, I was like, so now I wanted to go into like how it changes diaphragmatic breathing and how the vagus nerve innervates the
Oh my
diaphragm.
gosh, for the vagus nerve, even
Yeah,
better.
so what you just said, so it does change. It changes the
Yes.
energy of how we breathe, and it changes how we're able to diaphragmatically breathe. And our vagus nerve, which is our parasympathetic rest and repair, innervates the diaphragm. So it's like it's not just it's so it's it's the why. Like
Mm.
it's not magical. I mean,
Right. It all makes
it's
sense.
magically cool, but it's
Yeah.
not magical. It's scientifically backed on what it's doing and how it's changing, how our physiology, like just in how we breathe and how that changes our physiology, and how that can get us into parasympathetic tone, and then how we breathe changes like our carbon dioxide oxygen exchange, like all of those things
Okay.
matter to how our brain is able to perceive threat.
And I think the takeaway with that is definitely wear energy on those that lung one that
It's
location.
awesome.
And a lot of my clients do, and it is in the patching. I think it is for ice, energy and ice wave. I'm pretty sure it shows those two locations, probably energy primarily. So if you've got the energy patches, that would be where you could see. And we all have high stress. So I'd recommend that to be a good location. I kind of go back and forth with the energy on the bottom of my feet. I like to put them on the insides of my elbows. I like to put them here. And so I think that's a really good takeaway is when you're dealing with mouth and dental issues, this would be a good place to help you get through whatever it is you have to get through. And don't hesitate to reach out to me if you've got any questions, you need clarifications. You can always do that on the YouTube channel. When I post this up, there's going to be an area where you can comment about how wonderful Scott is and how you want to have him back again, and that we thank you so much for being here. But give me that information on my channel under the comments, because then I can track it back to what we did and I can also post it there. And that would be helpful. All right, Scott, I want you to go to your family and get a nice rest tonight. I thank you so much for being here on short notice, with filling in. I've had the person who was supposed to be here tonight. And as always, I look forward to talking to you and seeing you again. And thank you so much. We
Oh,
appreciate all that you're
absolutely.
doing.
She didn't tell. I had to pay her to come on, so it's embarrassing. But no, thank thank you. No, I love talking with you, and it's this is this is something that needs to be shared and shared and shared and shared
Yeah.
and share. It's just I think it's so important to me, and what I've seen in people's healing
Right.
that
Maybe we need to have, maybe this is something we could talk about where you come once a month or once every 6 weeks or something when we're both available. And then also it would be fun to maybe just do a Q&A. Sometime people do really like Q&A. I've done them here a few times and some people are shy and they don't want to speak up and ask, but you can also ask in the chat and then people can answer. I love Q&A. That's one of my favorite things to do with as a health coach, for people to ask me things, because then that's when I really shine, because then I can remember things. If I have to remember it, I don't but if you ask me, it prompts it. And I know Scott, you're really good at that too. So to be continued. We always love having you here, and you know you're always welcome. So
it was a
thanks
pleasure.
again. Good night, everybody. Thanks for staying with us, and we'll see you next week. Bye.